Hi, good morning. I think I'll start, and the good news is this is being recorded, so you can always go back if you miss anything. I'm Dr. Jennifer Kozerski. I'm an OBGYN at MediClinic Parkview Hospital, and I'm going to talk first about breast cancer, and then we're going to talk about the HPV vaccine. And then I'll leave time for questions, so please, you can type in the questions, and your amazing pediatrician at ASD, Dr. Omaima, will feed them to me so that we can hopefully answer everybody's questions. And just to let you know that this is very surreal to me. I really like being in front of a live audience so I can, gauge whether I'm boring the heck out of you or you're enjoying this. So I apologize if I bore the heck out of you. But like I said, if you're watching the video of it, you can just fast forward. All right, so let's talk about breast cancer. I am going to talk about the prevalence, the causes, the risk factors, ways to prevent breast cancer, and ways to detect it early. As hopefully all of you know by the pink ribbons that are floating all over the place, it's Breast Cancer Awareness Month, although we're almost at the end of the month, but it's always good at least once a year to visit this topic and discuss breast cancer. It is the most common cause of cancer for women in the US, and I am from the United States, so my data and everything that I talk to you about will be coming as an American physician. The latest statistics that I could find in 2018, 268,600 women diagnosed with invasive breast cancer, right? It's the second leading cause of cancer death in the US for women after lung cancer, and about 41,000 deaths a year. The good news is that rates have been declining since 1989, right? Why do women get breast cancer? Donald Rumsfeld, one of, I say this very sarcastically, one of the world's greatest philosophers. There are known knowns. There are things we know that we know. There are known unknowns. That is to say, there are things that we know we don't know. A lot of with breast cancer is there are things that we know that we don't know. It is hereditary, and there is a gene. The BRCA1 and 2 genes are the most common genes linked to breast cancer. And then there are other factors that can cause gene mutations, right? What are the risk factors? Well, being a woman is the biggest risk factor for breast cancer. And that's something you just aren't going to change, right? The older you are, the higher the risk, okay? The quote is about 1 in 8 women will get breast cancer in their lifetime. If you make it up to your 80s, that number becomes 1 in 3, okay? Having a personal history of breast cancer is a risk factor, and having a family history, especially if your first-degree relative, right, your mother or your sister, or could be brother or father, develop breast cancer before the age of 45. Oops. Family history of also ovarian cancer, melanoma, pancreatic cancer, prostate cancer, a male relative with breast cancer, Ashkenazi Jewish descent, early menarche, getting your period early and going through menopause late, so long amount of time of having estrogen in your body, first pregnancy over 30 or no pregnancies, not breastfeeding, and weight. Being overweight or obese in your postmenopausal years puts you at increased risk of breast cancer. 1 to 2 alcoholic drinks a day, exposure to ionizing radiation, and decreased physical activity. How do we prevent breast cancer? So I like this little cartoon. I do weights for muscle health, cardio for health, and chocolate for my mental health. So you want to be as lean as possible without being underweight in terms of trying to prevent breast cancer. And that especially goes for after the menopause. So my advice to women in the perimenopause, in your 40s, heading into your 50s, you want to be as fit as possible when you get into the menopause, because first of all, losing weight is really tough in menopause. Your metabolism completely changed. And second of all, you don't want to have that extra weight to decrease your risk of breast cancer. exercise, exercise, exercise. Sadly, for some, cutting back on alcohol. And not that you can really change this, perhaps at the stage of your life that you're in, but have kids early and breastfeed your kids. How do we screen for breast cancer? Well, we know that it's really important to find breast cancer early, right? Screening to find breast cancer early can improve your survival. And we know that mammography can detect breast cancer 3 years before you even feel a mass in your breast. We all hear stories about, oh, you're supposed to do your breast self-exam. That's really important. I think it's great to be in tune to your body. I think it's great to know what your breasts feel like, but the studies have shown that this doesn't really detect breast cancer any earlier than, for example, mammograms. So we talk about mammography. We also talk about MRIs, and a lot of women come into my office and say, I want an MRI. I want the best. Well, sometimes the best isn't the best. And we do really only recommend MRIs, magnetic resonance imaging, for women who have a high risk of breast cancer. And that would be, say, someone with a strong family history. The reason that the best, maybe not the best, is that one, it is expensive, and there are more false positives, right? Meaning that the MRI sees something in your breast, and that may subject you to an unnecessary breast biopsy. So let's just talk about mammograms, right? How often and when to start? Well, part of it depends on where you live in the world. Talking from a United States perspective, we usually start at age 40, and we say every 1 to 2 years. And it also depends on the kind of organization that you follow. So American College of OBGYNs says start at age 40 and every year. American Cancer Society start at 45 and then yearly, and then at 55 every 2 years. The US Preventative Service Task Force start at 50 and have them every 2 years. So there's not been a worldwide consensus. And in some countries where there's more of a nationalized health system that has to kind of limit the amount of screening because of funding for their health system, it may find that it's less often. In the UK, the Royal College of OBGYNs recommends starting at age 50 and then every 1 to 2 years from age 50. So part of what I say to my patients is, depending on where you're from in the world, that's the recommendation that I would follow. Although for me, I would say age 40, every 1 to 2 years. So this just goes through kind of all of the different organizations, and you can see there's a lot of them, right, that have different recommendations about mammography. So that was my nice, short and sweet talk on breast cancer and breast cancer screening. And I'm happy to answer any questions that anyone has about that.
Thanks, Dr. Kosierski. I'm waiting. I'm checking the chat feature and the questions and answers. I don't see any right now about breast cancer. So I'll just give it another few seconds. And then if you wanted to go ahead and move into your next talk, that would be fine.
Sure. I guess the other thing I would say is, although the month is almost over, a lot of organizations are offering free mammography this month. So if a mammogram is something that you need, or half-price mammography, this is the time to get it. The other thing is, for women who do get mammograms, I usually recommend doing it in your birthday month, because that way you'll remember, right? It's your birthday gift to yourself, and the gift to health is priceless, but that way you'll remember, because I know that sometimes I get out of sync with the things I'm supposed to do for myself, like my pap smears and my mammograms, and then I'm like, oh, I'll just go back to November when it's my birthday month, because I can't remember when the last time I did those things were. So
Dr.
even,
Koserski,
yeah,
there is
yeah,
one question, sorry.
yeah, absolutely.
One of the listeners is asking what is the current recommended age for mammogram now?
Sure. So I'm sorry, maybe you came in late. Part of it depends on what guidelines you're following. And here we can go back, I think. Can we go back? Yeah. So you can see there's lots of different recommendations. In general, women should start in their 40s and every 1 to 2 years. Again, it depends on who you're following. American Cancer Society says age 45. American College of OBGYN says age 40. So, and also different countries have different recommendations. And I always recommend go back to what they do in your country. Because as you know, in Dubai, we have doctors from all over the world who have all different kinds of recommendations.
That makes sense. Thanks, Dr. Koserski. The next question is, do you have tips for a woman who's getting her first mammogram? Anything important that we should know?
Yeah, so you shouldn't use deodorant the day you do a mammogram. And I think that's really the only thing that they say you shouldn't do before a mammogram. It's not like the world's best experience. I mean, it's, you know, you're not going to have tea. Well, maybe you'll have tea with your friends afterwards. I think here at MediClinic Parkview, where I am in the breast center, they'll offer you a nice cup of cafe latte before you get your mammogram. But, you know, I'm assuming that the women who are watching here now have all had kids. There's nothing worse than childbirth in terms of discomfort. So if you can have a baby, you can get a mammogram. And it's really quick. It's really, you know, people make much ado about it. Yeah, it's not comfortable, but it's okay. You can do it.
Thank you. There's a question here about whether or not you know of a better machine being invented that isn't as painful.
Well, I always joke that, you know, clearly a man invented the pap smear because, you know, so I don't know if there are any women out there, you know, inventing machines that aren't as squishing. Someone once described it as taking 2 big dictionaries, putting them in a freezer, taking them out, and then smushing your breast with it.
Thank you. I think that's it for the breast cancer questions for now.
Okay, well, let's go talk about HPV, because there's exciting news for Dubai here. Hold on, let me just pull up my HPV. Great. So let's change topics a little bit and talk about how we protect our kids. And I say kids because I mean boys and girls, okay? HPV vaccine is not just for girls or women. Boys and men can get it, and we'll talk a little bit about that. Sorry, this slide is cut off a little bit in the top, but let's just first talk about something that I find fascinating. I think everyone watching this now is more of a virologist, knows more probably about viruses and spread of viruses than you did at the beginning of the year, unfortunately. But in addition to viruses like COVID and influenza, we know that some viruses and bacteria, actually, infections can cause cancer. So if you look at this, I mean, I think this is really kind of fascinating that, you know, H. pylori can cause stomach cancer. Epstein-Barr, EBV, can cause nasopharynx and lymphoma, right? And so we know that the HPV virus can cause cervical cancer. And if we look at HPV-associated non-cervical cancers, so we know that HPV causes cervical cancer, but we also know that it can cause anal cancer, vulva and vaginal cancer, penile cancer, and oropharynx, like your larynx cancer. And if you look at this slide, which is a little busy, but you can see blue means female, and the gray is male. So clearly cervical cancer is only in females. Only women have cervixes and uteruses, right? But anal cancer we see in men. Again, vulva and vagina you only see in women. Penile cancer obviously only in men, and oropharynx, right? Your larynx, your throat, basically. The majority of that cancer actually caused by HPV we see in men, and there's been an upsurge of it, especially in men. So HPV vaccines can help prevent all of these kinds of cancers, right? I always say that the HPV virus is the common cold of the genital system, right? Because it's just so common. So we estimate that 75 to 80% of sexually active men and women will become infected with HPV in their lifetime. Okay, that's a lot. In the US, that's about 80 million at any time, and with 12 million new infections every year. Okay. In terms of transmission, it's unfortunately fairly easily transmitted. And as much as we, teach kids to wear condoms, right? Because condoms prevent the majority of sexually transmitted infections. A condom does not necessarily prevent HPV infection, okay? Because HPV infection comes from genital or skin-to-skin contact. So important to know, and we still need to emphasize condom use, but it doesn't mean that it's necessarily going to prevent HPV infection. So why should we get the HPV vaccine, right? We've already seen that HPV is linked to all these cancers, right? So we want to reduce the risk of the infection and therefore reduce the risk of disease. And we also want to create herd immunity. And I think, again, going back to what I said before, everybody is now an expert in viral transmission. And I think the idea of herd immunity, we've heard more and more about it, right, because of COVID. But really with HPV, that's what we want to create. We want to create this group that's immune, that lowers the amount of virus within the general population, so that the population that perhaps hasn't been vaccinated is going to see a lower incidence of the disease that the virus causes. So in this case, with HPV, a lower incidence of cervical cancer, penile cancer, anal cancer, vaginal cancer, oropharyngeal cancer, and also HPV that causes genital warts. And HPV, in addition to the cancers, does cause genital warts. And while genital warts won't kill you, they can be very uncomfortable and very kind of disconcerting to people who end up with genital warts. So the human papilloma virus vaccine, there are a couple different options, right? So what kinds of vaccines are available? So currently in the US, the only vaccine that's available is the Gardasil 9, okay? And it protects against nine different types of the HPV virus. Up until this year in Dubai, we only had Gardasil 4 available to expats, okay? And now, prior to this year, the UAE government had the 9, but they made that available for local population, which is fantastic, but it wasn't really available for expats. So now the 9 is available. It's been, I'd say, less than a month that it's been available at MediClinic and other facilities. Cervarix, which is one of the original vaccines, is really only available in Europe these days. So what does this mean, right? Gardasil 4, Gardasil 9, Cervarix. Well, it has to do with the number of HPV types that are being protected against, right? So 9, obviously 9 different types. Types 16 and 18 are the most prevalent types that cause cervical cancer. that also cause oropharyngeal cancer and anal cancer, I would say all the genital cancers, okay? Type 6 and 11 are the two most common types that cause genital warts, okay? So Cervirex doesn't protect against anything related to genital warts. Gardasil 4, or just the regular Gardasil, protects against the 6 and 11 against genital warts, and 16 and 18, which cause cancer. Excuse me. And then Gardasil 9 has the addition of 31, 33, 45, 52, and 58. Now, 45 is particularly important because it's the most common that causes adenocarcinoma, which is one of the most aggressive types of cervical cancer that you can get. So you're getting a bonus with Gardasil 9. And here I just kind of wrote it out. What's important to know is that type 16 and 18 HPV cause about 70% of cervical cancer, okay? When you add those other 5 types, 31, 33, 45, 52, and 58, you're accounting for another 10 to 20% of cervical cancers. So the Gardasil 9 pretty much gets almost 90%, protects you about 90% against these cervical cancers, okay? Type 6 and 11, which cause the genital warts, 6 and 11 cause 90% of the genital warts. In terms of when to get the vaccine, well, the recommendations are for as young as age 9 and actually go up to the age of 45 now. If you get the vaccine, if you start the series before age 15, you only need 2 shots, okay? The first shot and then another shot or vaccine 6 to 12 months later, okay? If you start after the age of 15, you do need 3 doses at 0, 2 months, and then at least 6 months after the first. A lot of people always ask about vaccine safety, right? How safe is it to take a vaccine? I thought this was an interesting slide in terms of how safe are vaccines. Well, you're much more likely to be struck by lightning. You're much more likely to be in a plane crash than you are to have a grave or life-threatening reaction to a vaccine. Over 100 million vaccines have been given in the US. And, it's amazing that we have a vaccine that will prevent cancer. Usually we give the HPV at the same time you would bring in your child to have a meningitis vaccine and a whooping cough vaccine. So if your pediatrician here doesn't recommend it when you're going for those vaccines, I would encourage you to bring it up. I don't know how in tune all pediatricians are to HPV. Dr. Omaima might be able to give us some thoughts about that. But certainly if your pediatrician doesn't offer it, then, bring it up because it should be part of the, routine vaccines that children are getting these days. What are the side effects? Pain, redness, swelling, kind of similar side effects to any vaccine. They have noticed, and you have to remember the population that's getting this vaccine are, teen or tween girls. They've noticed a fair amount or more than the usual amount of kind of syncopal episodes of fainting when the vaccine is given. But in general, it's a really, really safe vaccine. I usually put up this slide because the whole idea is that we don't want to get to cervical cancer, right? And you can see this is like, it's an iceberg, right? So the cervical cancer is what's on the top. There's a huge amount that's underneath the surface that we can prevent from even getting to cervical cancer. So the whole idea is to vaccinate so that we don't even, have to worry about cervical cancer. And that's my talk on HPV. Happy to answer questions.
Thank you so much, Dr. Kacierski. You have a few questions. Some I know you answered, but maybe it would be helpful to refresh. One question is it still important for a young person to get the virus even if they are not at all sexually active?
Yeah, so the whole idea, I mean, we all hope that our 9-year-old, we all forget that. We know that our 9-year-olds are not going to be sexually active, right? But we want to build immunity before they become sexually active. So that's why it's about starting at that early age. I usually tell the story of my child who's now 22, but when she was in 7th grade and going to her first school dance, I think she must have been around 12, and I hadn't vaccinated her yet because in my mind, well, she's not going to be sexually active forever, right? But I remember she walked down the stairs, she had this super short skirt on and these way high heels that she clearly got from a friend because I didn't buy her high heels. She walked down the stairs to go to her first school dance. And I looked at her and I said, oh, tomorrow we're going to get you the HPV vaccine, right? I mean, she's a good kid, but and you don't ever think that your kids are going to become sexually active, especially, a 9 or a 12-year-old, but eventually they will. And so the more they can build up immunity before that, the better for them. We now, it used to be that the cutoff was age 26. We now know that you can vaccinate up to age 45 in both men and women and still confer immunity. So it isn't necessarily too late. It is too late if you already have these types of HPV viruses, but if you don't, then you absolutely can get vaccinated.
That's great. Thanks, Dr. Kacierski. Another question. I know you do have a slide on this one about the risks or side effects associated with getting the HPV vaccine.
Yeah. Oops. Here. Sorry. Yeah. So. Oops. Yeah. I mean, the biggest risk is just local reaction, right? Where is that? Yeah. Pain, redness, or swelling at the arm site. You can get a little bit of fever, headache, or feeling tired, muscle or joint pain. But in terms of long-term risks, there hasn't been any.
That's great. Do you know how long it takes to develop immunity after you've completed the series for Gardasil?
That's a good question. I don't know that I know the answer, but I can find out. But okay, I don't. Yeah.
Thank you. And do you know if young men in their early 20s can still get it, and where in Dubai? You mentioned MediClinic. Are there any other places that you know of where someone can get their Gardasil 9 and are young men in their 20s also able to get it?
Well, and I think anyone can get it in Dubai. Unfortunately, most insurance companies in Dubai won't pay for it. So you've got to pay out of pocket. This is the competitor, but I've heard that King's College has a deal on the vaccine where they're offering kind of a package. I know at MediClinic, we do each one individually. I want to say that it runs between 600 and 700 dirhams a vaccine. So if you needed, if you're under the age of 15, you only need 2, that's not too bad. And maybe I would assume some expat insurance like Cigna, an insurance company out of the US probably will pay for it because they certainly do in the US. But a lot of insurance companies here don't pay for preventative care. But the vaccine company has distributed it to all the major health centers. So I think anywhere you can find it, you might want to just call around for pricing.
Thanks for those tips, Dr. Kacierski. Do you know what the pathophysiology is that causes kids to faint after the vaccine?
I don't. No.
Okay, thank you. And then, I have a theory, and that's, as you said, tweens and teen girls tend to not have their breakfast. They tend to be hormonal at that time. They might be on their period. they might not be well hydrated. I think just the perfect storm happens when they see the shot. And so I also ask them to stay seated for 5 minutes and to get up slowly after their shot, even if they say they're feeling fine, just to be on the safe side. But normally it's not something long-term. Once they feel better, they're back bouncing off the walls as usual and they feel fine. I think it's just the first 10, 15 minutes after the shot that they might feel a little bit dizzy. There's a question here about genital warts. Do you know if they're curable or recurring?
So in terms of curable, we can, there are a couple ways to get rid of genital warts, right? You can, depending on the size of them, there's a medication called Aldara, which is an amazing medication that you can put on. It can take up to a month to get rid of them by putting on this medication, but the nice thing about it is you can self-medicate. Or if they're bigger, sometimes they need to be burned off or cut out. So they can be quite debilitating. And yeah, the problem is that partners can give the virus back and forth to each other. So I've had, you know, in the years that I've been practicing medicine, I've had 1 or 2 patients who it just seems like every month they're back, right? They got rid of it, but then because it's that idea that the virus is living in the external genitalia, it's not just, you know, it's not just on a man's penis or in a woman's vagina, because then great, condoms would really be helpful. But if it's on the external genitalia and you have, you know, touching of the external genitalia, you can keep transmitting the virus back and forth. The idea is that hopefully your body will clear the virus, right? We don't have a cure for the virus, right? Once you have the virus, either you have it and it stays with you, and those are the women, men and women who tend to progress on to cancers, or your body's immune system clears the virus. And so, you know, I say it, you know, lightly or, you know, kind of jokingly, the only way to cure it is to be happy and healthy, as if that's really easy sometimes, you know?
Thank you. I went through all the questions. I think you answered all of them. I don't know if we want to give just a couple more seconds. Oh, one more just came through. What does it mean, or is there something to do if at almost 18, one breast is a little larger than the other?
We're not symmetrical beings. You know, if you wanted to take your child for just a breast exam, just to make sure there's no kind of lipoma, fatty tumor in the breast or anything making the breast a little bit bigger. But most people have, most women have one breast that looks a little different from another. So I wouldn't, you know, make much about it. Again, we're not symmetrical.
I had a question actually, speaking of breasts, and what's your normal recommendation for a teenage girl who has lumps in her breasts? So like what might be cystic breasts?
Well, the one thing I would say is don't let people start cutting them out unless they have a really high suspicion. Because it just causes, you know, anytime you traumatize a breast, right, start cutting into it, that actually increases your risk of breast cancer. There's this, it's called the Gale model. It's a model that we use to predict risk of breast cancer. And one of the risks assessment is how many breast biopsies you've had. So the last thing you want is for a young girl or woman to have their breasts, you know, cut into. I think, you know, making sure that you go to a competent physician who is gonna, you know, just advise the right thing. But yeah, I mean, we all have tend to have lumpy, bumpy breasts. Some, you know, women have it earlier than others. For women who have a lot of cysts in their breasts, caffeine can make that worse. So trying to cut down on caffeine. or taking a supplement like evening primrose oil, vitamin E, or omega-3 fatty acid can also help with kind of breast health and decrease that lumpy bumpiness.
Just a couple more questions, Dr. Kosierski. Who's allowed to give the vaccine? Is it just pediatricians, gynecologists? Where should someone go if they want to get the vaccine?
I think that pediatricians definitely can give it. I mean, I think anyone can give it, but who feels comfortable prescribing it? Pediatricians, gynecologists, and then family practice doctors. You know, I think you just have to kind of know your doctor. You know, the beauty of Dubai is we have all different kinds of cultures here who have all different kinds of I don't know, you know, feelings about sexual activity, and getting a vaccine doesn't mean that your child is sexually active. It means that, you know, eventually they will be, and we all hope for that. We all hope that our kids grow up to have fulfilling relationships that involve sexual activity. But maybe some doctors don't feel as comfortable. So, you know, you might want to just, if you have a pediatrician that you love, just, you know, shoot them an email. Hey, can you, you know, are you prescribing the HPV vaccine? And if they're not, there are plenty of other people who are.
Sounds good. And then there's a question here about periods. Are there any blood tests we should ask for if our girls are about to get their period or just got their period?
No, it means that I call the menstrual period the fifth vital sign, right? It means everything's working. So unless they're having horrendously, you know, heavy periods and you're afraid that maybe they're a little anemic, but otherwise, no, your body's working. It's doing what it's supposed to.
That makes sense. And then the last question I see here, it has to do with the lumps in a woman's breasts. Can they turn cancerous?
Well, it depends on what they are and what they look like, right? So, you know, having them evaluated. So a lot of times we talk about mammography, but also ultrasound is a nice kind of adjunct to the mammogram to really kind of classify what those lumps are. And then usually, so if, for example, you had a mammogram and it showed what's called a fibroadenoma, that's usually a benign growth of the breast. A lot of times they'll ask you to go back in 6 months for an ultrasound to just make sure that it's not growing at a high rate, because that rate growth can be an indication of kind of something a little more sinister.
And another question just came through. This has to do with Gardasil side effects. I know we talked about the common ones, but I think maybe this person's asking about some of the ones you read about on the internet, the more dramatic potential side effects of Gardasil. Can you elaborate on if these are a worry or not?
I don't think they are. I mean, I have 2 kids. They're both vaccinated. If you talk to, you know, 100 OBGYNs, 100 pediatricians, most of us have our kids vaccinated. Now, sometimes it takes us a little longer to get there, right? I told, if you missed the story about my daughter being 12 before I vaccinated her, because I just couldn't in my mind fathom that she's going to be sexually active. But no, and it's been around for a long time. And actually, I didn't realize this when I was doing some educating myself a little bit about Gardasil 9, because I've been here for a long time. Gardasil 9 has been available in the US since 2014. It is the only Gardasil available since 2014 in the US. We're in 2020. That's 6 years that we haven't had this vaccine here. So, I mean, the fact that it's been around for that long, and it's been, and the whole Gardasil series has been around, I want to say since about 1998 or 2000. So we have a 20-year history of this vaccine. And if you look at countries that have done massive vaccinations, and Australia has been the best vaccinator with HPV of any country on the planet, their rate of cervical cancer, their rate of genital warts, their rate of HPV-related cancers has gone down significantly in the last 20 years. So in terms of bad side effects, it's just not there.
Thank you, Dr. Kacierski. I don't see any more questions coming through. Thank you so much for such an amazing talk. I'm also getting my daughter vaccinated next week. So same thing happened to me. I couldn't fathom my 12-year-old, but it's time. So we're gonna do it. But thank you. Everything you talked about was very, very relevant for our families. I'm just looking through the questions and answers. I think you answered all the questions the attendees had. Thank you so much, Dr. Kacierski, for your time and your excellent talk.
Oh, my pleasure. Nice to see you.
Bye-bye. Thanks for listening, guys.